Hello, my name is Gulshan Kaushik. I welcome all of you to Logistics Shakti Podcast series. Um, Today, we are actually meeting a personality who come from a industry which is transforming the entire healthcare logistics and the supply chain. I have Mr. Amit Gupta with me, who is from Credent Connect Care. While I am talking about him, it's always better to hear it from Mr. Amit Gupta only. So, Amit, why don't you talk about your company? What do you do, and what
Sure,
exactly are
sure.
you based
So,
at?
hi Gulshan. First of all, thank you for having me on a podcast. It's a pleasure. I'm Amit Gupta. I'm director and CEO at Credent Connect and Care. We also call it C3. So, C3 is a healthcare B2B service provider. We work with healthcare companies and we help them to collect patient samples and move to their labs at a faster pace. We are present into 450 plus cities and 20,000 plus pin codes pan India, and we are 6,500 plus workforce.
Great, great. It's always amazing to meet people who are actually working in solving a lot of problem for the common man. Right. In earlier of our days, we used to go for a blood sample, right, and now companies like you who come and collect the blood sample and make it reach to the right places.
Sure.
Phenomenal. I'm really glad to have you here. Right. So, Amit, while we are talking about logistics, supply chain, even in Logistics Shakti, we are talking about it. What do you think that, you know, while the entire global supply chain is being redefined, what is one shift which India must prioritize today?
It's a very different time. I'm saying different time because we all have seen crises going on at global level in our life multiple times, right? Every single decade, something happens, but it's a different time. We don't know what is going to happen next week, and we don't know what is going to happen following week. In fact, we don't know what is going to happen tomorrow or day after, right? It's a great time for India right now. So far, India has built logistics at a scale and at a cost efficient network at a very cheap cost. Current crisis is not asking for cheaper cost. It is saying reliable network. Can India build a reliable network? Can India build a resilient network which can overcome these kind of crises? Can we build our infrastructure at a bigger scale? That's we need to do. Let me give you a few examples. I think India needs to build execution at quality with quality, and India needs to build execution with scale also. What that means is currently we spend in logistics around 9 to 10% of our GDP. Developed countries spend only 7 to 8%. It means we are spending more money and doing less work. We need to be very, very efficient. India needs to be very, very efficient. We need to reach there. Second is execution at scale. Currently, we are around $350 billion industry, plus minus few billions here and there. India will reach to around $1.2 trillion in logistics by 2035 in next 9 years, where GDP will be around $15 trillion. What that means is from 350 billion to $1.2 trillion, it will be fourfold. If we have to reach to that scale, are we ready? I believe not yet. India needs to do a lot of work to reach that scale with quality and build a lot of resilient network. That is my take.
Nice, nice. You know, entrepreneurs like you who have resilience, who actually work on such data day in day out and visualize that how exactly that world will be wherein we are going to hit. Um, I'm really really happy to actually have such wonderful insights from
Thank
you.
you.
Great. So while you come from the healthcare, right, and we are talking about logistics over here. Um, while we are actually going to hit that scale, how do you think that the entire logistics impact the healthcare?
Logistics as a healthcare is totally different segment. For example, healthcare, for example, diagnostic, pharma, all these are very, very critical for healthcare. In fact, healthcare doesn't work without logistics. Logistics is a backbone of healthcare. What that means is, for example, we're into diagnostic industry. So we collect patient sample. Now patient sample needs to be collected and it needs to reach to lab at a very, very short span, let's say 2 or 3 hours. It needs to be packaged right and it needs to be temperature control with 2 to 8 degree. If logistics is not there, healthcare will not scale. So I believe healthcare needs to scale with logistics only. Second is we also participate in a lot of PPP programs. What that means is public-private partnership with governments. We collect patient sample from tier 3 and tier 4, and all those samples have to reach to labs which are 200 or 500 kilometers away. Now it has to reach in few hours. Again, temperature 2 to 5 degree. We do all these things. If logistics is not there, those sample will not reach to lab. So I think that's the backbone.
Great, such wonderful thing to know that while we are really concerned about our health, right? I have not seen logistics that way, right?
Yes.
Wherein you mentioned that
Yes.
it is the backbone and that is how it is, right? And you mentioned that this is more of a critical space.
Yep.
We are operating in when it comes on health, and we as Indian also are being health first kind of a people now, right? What are the risks in the supply chain exist into your business?
As per my understanding, there is general delay or damage, or there is no visibility. If there is delay, it happens because of route disruptions. Some route is not working. What do we do? Right? So the delay. Second is disruption.
Okay.
It happens, for example, infra is not available. We do a lot of programs on tier 3 and tier 4 cities where we need to move samples. For example, if there is a remote village in Karnataka or Maharashtra, we need to bring those samples, which are, let's say, 500 kilometers away from Bombay, and lab is in Bombay. The sample has to reach there. If temperature is not maintained correctly, and generally temperature is maintained 2 to 8 degree, which is our devices are for the 12 hours. If sample takes longer time, it will get damaged, right? So it has to be, we have to protect from damages. Third is opacity. Those are the risks. It means if there is a delay or something happened on the supply chain and there is no visibility to me, I can't provide solution, right? So there should be a visibility by technology. We need to understand why delay is happening and damages. These are the risks I see. If we can solve those things, it is easy to provide solutioning.
Fantastic. It looks like I'm talking to a doctor who operate into into a particular space, because as a common person, I've never seen logistics into healthcare like that. Right now, while you talk about that, there are many risks, right, which are there in the entire supply chain. While you are maintaining temperature, doing every possible thing to make sure that the sample reaches the lab, right? And I get a right report about myself, right? How do you think that reliability can be improved, or how actually you work on the reliability in the entire supply chain function?
Logistics is a very fragile thing because it is all on the field things and anything can happen on the field, right? So if we have to build reliability, one thing is processes. Build a lot of processes. It should not be people dependent. That if I think it should happen in certain way. No. What is my SOP? Build SOP all around. If something fails, there is a SOP how to resolve this thing. Build a lot of resilience in the network. If something fails, every time those weaker point fails first, understand those weaker point and build alternate things over it so that it can be corrected at the same time. Bring technology to automate, to monitor, and to track. If technology is there, we can bring a lot of transparency and it helps to bring reliability also. If, for example, you have given your blood test and you want to understand when report will come, it has been 9 hours, 10 hours, 11 hours. Now you are worried. There is no transparency, right? You will say, I don't know what is happening. But if there is a transparency, you will know, okay, my report will come in 1 hour. So you will be relaxed. So that kind of transparency. Third is culture, people. Logistics is all about people. So people who understand logistics, if something breaks, how to resolve those things, these three things, SOPs, technology, and people. If these things come into at the proper place with the right things, I think things become better.
I think, yeah, very, very well elaborated, Amit, right? Because if I order from Zomato, I'm worried about my food if it doesn't reach me in 30 minutes.
Right.
While I have not seen the report, in
Yes.
case if I'm worried about that report, that bringing visibility into that particular segment will definitely help a lot more, right? Um, I think it has been a very wonderful insight from you, Amit. Thank you very much for being here. It was really pleasure talking to you and understanding the healthcare from a logistics aspect.
Thanks a
Thank
lot.
you. Thank you very much.